quality healthcare delivery. They said that they will scrap the National Health Insurance Levy and ensure timely release of payment to service providers and additional funds to finance healthcare for Ghanaians. So that is what they will do. They say they will scrap the health insurance levy. So the question will be, what are you replacing it with? Because I believe the levy will raise some revenue for the health insurance. So if you are scrapping it, what will you replace it with? Then they said that they will establish the Ghana Medical Trust Fund Care, which they call the Mahama Care. Cares, So it's just like the Obama Care office. So I think that's what they wanted to do there. To support the cost of healthcare for persons with chronic disease such as kidney failure, there's dialysis, cancer, sickle cell disease, diabetes, hypertension, and heart diseases.
Yeah. We've been hearing stories of people who are suffering from these and the plight that they go through, the financial constraints, and the lack of equipment to take care of them and all that. So I think it's an area.
I think was it yesterday the Confanochi CEO was also saying that they need dialysis machines about 25
or so to make sure that they operate smoothly.
Kulebu has recently received 30 of them.
I just hope that we don't come back and talk about this.
And
government.
Yes, and the third one, they actually repeated what you said in the 2021. That is why I wanted us to go. It's just the 2024 one is just like
an upgrade. They
said an increased free primary health care from the CHIP compounds to the polyclinic level in the short to medium term. So there was no timelines given. Expand health infrastructure to restore
prompt employment and timely development of health workers.
So that's what they also want to do there. Then what's the next one? If you can check your phone for me.
Okay, it says they are going to provide affordable accommodation within the premises of health facilities and offer home ownership schemes for health and other workers. Should I continue? He says...
No, I'm coming. Right. So, we'll read it again.
He says... They are going to provide affordable accommodation within the premises of health facilities and offer home ownership schemes for health and other workers.
You remember Kufado promised teachers 10,000 homes?
Yeah.
Do you think this promise is viable?
I mean, let's just take it like that.
Then they said one of the things that they will introduce a vehicle tax waiver scheme for health professionals under a well-regulated system. So basically, just like what the MPP is also saying, but they didn't state the engine capacity and all that. And the tax waiver, mostly when they say that, it's not like the vehicle that they are giving you for free. It's just the taxes that are on the vehicle when you bring them into the country. And for me, this thing, if you actually want to do it, we can do it, but you must leverage the local expertise, the likes of Apostle, the Christo Asafo, what's the name? Apostle Kantanka. I've been to his place twice, actually. It's at Gomo and Porta, the Porta also, the manufacturing plant. And when you go there, they are doing a lot of stuff there. And I think that maybe if we give them the support and all that, we can get some of these cars. The Uber-like cars. And all that,
some of these brands, when you look at brands around the world, it's some of these policies that made them famous in the first place. Nike, for instance, used to be an apparel that they distributed to high school kids. So it became cool if you were in school and you play sports and you wear Nike. One of those. And now we have it. So if Kantanka, we can, shady deals be another carpet thing, but properly resource him with the personnel and money and the investment that he needs. In the next few years, Kantanka cars will be shipping out of the shores of Ghana, and who knows?
Okay, so we can even be saying that we are giving them this opportunity to showcase to us what they can do.
What they can do, their
and
capacity.
Going forward, we can scale them up and all that. Yeah, good one. Then they said that they also provide scholarship opportunities for nurses and allied health workers to pursue PhD level education. I think that's good. Career growth is important. And it's one of the, and for me, these things should go to the people in rural communities. The last time, for example, I had opportunity last Saturday. I was in a USM government program at the Institute of Social Economic Research, or ISE, at the University of Ghana. And one of our alumni was Dr. Richard Salome, the current General Secretary of the Ghana Medical Association. He works at Shidium in the Afro region. And interesting, his president is also somewhere in Bekwai. And one of the conversations I was having with him, and we were like, see, these opportunities should go to the people in the rural areas. You know, not their colleagues in Accra, because already they have the advantage of going through the vocation, the machinery and all that to train and qualify specialists and all that. So these people should be the ones to get some of these. By the end of the day, you see, and they will be giving it to those in Accra, posted to Rage and Kolebu and all that. So we need to get it done. Then they said that they reward health workers who accept posting to rural communities and underserved areas with a decent rural allowance of 20% of basic salary. And shorter service periods for promotion and steady leave. Very good one.
Yeah.
So it means that if you're, let me just calculate it for you. So now, what is the average salary? Leo, Joe, I think the last time I said you know a nurse who's a very close friend. Do you know her salary? I think that their salary is mostly, let's even say 3,000, right? So if it's 3,000, it means that you get 600 cedis more, 20%, right? If my math is right, 20% of 3,600. So it means that, okay, I hear their classes, the diploma is 2,005. Okay, so let me calculate for 2,005 too. Joe has a lot of, female nurses as friends. So that's why he has all this information. So he says that according to Joe, my producer says that diploma is 2,005. Is it net or gross? Then degree is also 3,000. So if it means that if you go to rural areas, the district, for example, Mansour Dubia, we know it's a rural community. So if you're a diploma nurse, you get 500 cedis more.
Yeah.
I mean, this will encourage, because a year is a what?
Yeah.
By 12, 500 by 12, a year is like 6,000.
I mean, even 20% is even small. 30% will be okay, because these areas, transportation is.
What's that? 20 is won't be to your cry as a man. But it's important, because as you've done the math here, if you're earning 2,500 monthly, right, and you're getting 20% more every month, that is 6,000. You can even use that as your rent. So that alone is enough.
It will cushion you in a way.
To go, and also the steady leave abroad and all that. That's important. And if it takes somebody 3 years to be promoted to another level, and you, because you are based in the rural area, you take 2 years, I think that is also a good thing to encourage them. Give us the next one, the 10.
The 10, it says they were going to introduce a specialist nursing programs in nursing colleges to support career advancement and skills upgrade of nurses to meet global standards.
Oh, okay. So it means that currently they are all trained, they are lumped together. So they want to, maybe if you want to be a cardiologist nurse or something.
Yeah, so that you can specialize.
Okay.
They are also going to mainstream and research-backed herbal, traditional, and alternative medicine and practice inpatient management at all levels. This
thing is important.
Yeah.
The kinds of money China is making from
herbal medicine,
herbs.
Yeah.
The last time I was reading on it and I was amazed. In fact, when you read from the Chinese herbal growth, they did a market research analysis on it. And China in 2022 had 44 billion just from the herbal sector.
Yeah.
Herbs, spices, and all these things. And in fact, what they are doing is that they are going into their virgin forest and they are trying to do research on almost every single plant and herb in there.
Sadly, ours, we are just, knocking them down with excavators to go and dig for gold. And these are the places that has all these plants and medicines.
But if you are getting 44 billion from herbs alone, and Ghana comes say, give me 3 billion.
Yeah.
Charlie. And we have a lot of champon, we have the moringas, the other ones, the ones you cook a lot.
Yeah.
Even akoko mesa.
Yeah.
Look at akoko mesa, for example.
We have thyme and then bay leaf.
Bay leaf.
Yeah.
We could have just packaged it somehow and just,
You know when it comes to herbs, ours over here, we don't regard them at all. Even in our daily meals, the average Ghanaian rarely eats anything vegetable, anything fresh. Okotomoa, so I want to see the salad near the begusuna. That's the only vegetable they eat. Nothing raw, nothing fresh.
But it's expensive now.
Yeah, yes, I understand that. But what I'm trying to say is, I also use some of the Chinese friends I used to have as examples. And sometimes we'll be walking around, cocoa farms and all these areas, and they see some leaf, they rush to it, and the way they talk about it. Here, Papa be home, all this year. But them it's general knowledge. They really do understand the use of these things, and over there they protect them. I went with one over to a house and they had a moringa tree. And he said, the Chinese asked, his name was Mr. Lu. He said, I want some. And the guy said, oh, you can take all you want. Before I knew, no, or they said, can you try the thing in a form? And the way he was rushing, you know, tying them in bundles, naming them, this is for my mama, this is for my uncle, this is for my brother. He told me 1 ounce of that cost about $1,000 in China.
Wow.
That was a high-end real. So, I mean...
it's about priority.
Yeah,
for me, but
we need to codify it.
It's also how some of the herbal people, you know, a drawback when say
50, you know.
You see, I think we need to... I think KNWest is doing a lot like that now. They have even certification for some of these people where they will train them. You know, the toxicity, if is listening, they have these... how do I the toxic levels, even the levels you have to take it, the dosage and all that. They need to regulate those things, because I think that we can leverage a lot. Because if someone is getting 44 beds, just like the cocoa sector, every year we have to go and get syndicated loans to come and fund these things. But someone sits in Germany, someone sits in Switzerland, they don't grow cocoa there, they don't go through the hassle we go through. Add value to it and make billions more, exceedingly more. Let's go to the 12th one.
12. He says they are going to support the Pharmaceutical Society of Ghana with incentives to make Ghana a pharma hub in Africa.
COVID taught us that, and if you wanted to be serious at these things, you should have done it long ago. But if they want to do it, it's a good thing. Because most of our the last I had a conversation with a friend. I think she's a Pfizer. She's a Pfizer, and we're having a conversation about it. And you see, I learned that the antibiotics that are 2,000, 3,000. And there are some in the system produced locally. The prices are cheap and all that. And the people are even not being able to penetrate the market because of the influx of these foreign ones. So if you have the local expertise and you can build them to the level where they can also give us semblances of the quality we see on the shelf. Because there are some medicines you buy, the packaging and everything. There's more we can do in that space. At least to take at least 40% of the market, 50% of the market going forward, and retain profits in the country, create jobs for the people and all that. It's not bad.
So they are going to construct a state-of-the-art 500-bed specialist children's hospital and fertility center in Accra.
For me, the children's hospital, I support the fertility center. Maybe it be long process. I mean, there are many hospitals offering fertility.
Private hospitals.
Yes. So why are we creating a dedicated fertility? I don't get the rationale behind that policy.
Well, you think the government should not invest in that? Yes, my producer is
still working the lines. If you get their spokespersons on health, you ask them, why is the government interested in setting up a fertility center? There are many hospitals across the country.
But those ones may be expensive. Government ones will be more accessible.
No, but there are no more private hospitals than government hospitals in Ghana. So we can take a policy. We can go through the National Health Insurance route and say that if you want fertility health care, like we are doing for the dialysis people, that less than 18 and also more than 60 or 65, you are entitled to some free dialysis. You can go through that conduit. It's just like my argument for the Women Development Bank. You know, we already have some of semblances of some of these banks and institutions in our system. So why don't we just create dedicated decks or create a dedicated policy for some of these things instead of creating a whole new thing, you know?
So the English name for basil, I'm told, for Akokomesa is basil.
Basil.
Yeah.
No, not what bay leaf.
Bay leaf.
It's basil.
Basil.
Okay. Oh, but that thing, you know, when you prepare chicken with Akokomesa.
Yeah.
Charlie, it's more nicer than some of these prices on the market. You know, and we can package it and sell.
You know, back in the days when, chicken soup had this extra strong aroma.
I've spoken about it before during the Ghana months.
Yeah.
Now, chicken soup doesn't give you that aroma again. It's gone.
It doesn't travel 3 feet from the pot. Okay. So 15, right?
No, the 14.
14 says they were going to refurbish the Kolebu Teaching Hospital as an additional ultra-modern quaternary specialist hospital to reduce medical care and training abroad.
We should even have years. We can say that our teaching hospitals, that every 5 years we read through them, we refurbish, if not to 2-4.
Mm-hmm.
Look at
so the point 16 says they are going to refurbish the Konfanoche Teaching Hospital to meet the standards of an ultra-modern teaching hospital.
To all these years, what were we doing?
Yeah,
it's a good thing. They need to, and it should be a regular thing. Now, the 15 said that what they will upgrade the regional Greater Accra Regional Hospital into a full teaching hospital as it links it to the College of Physicians and Surgeons for specialist training. When we get them, we ask them, where are they also pushing Atonsu Agogo to a teaching hospital? Because this is the region I live and work. I'm not saying Greater Accra doesn't deserve it. No, it's a good thing. All right? We have more doctors in the system. We reduce the doctor-patient ratio and all that. But Ashanti region. Because if Accra has UGMC, which is a specialist hospital. If Accra has the premier health institution in the country, Kolebu Teaching Hospital, if Accra is going to have, according to the NDs, if Ghanaian finds favor with them, and they renovated the regional hospital for the record, so meaning that we can trust them to go back to that same facility and upgrade it. And they are going to have these 3 facilities. And let's not forget, they have other specialist hospitals in the system, the Bank Hospital and all these things. The Ashanti region,
all in one region.
And they are treating lesser regions compared to the number of regions that Konfanoche attends to. So beyond Konfanoche, when are we also getting a semblance of UGMC? When are you getting a semblance of RIDGE, which is now going to be a teaching hospital if the Ghanaian people finds favor with John Mahama and give him the mandate in December? We need to ask those questions. It's very, very important for me. Now, they say that they also expand the whole teaching hospital to provide comprehensive. Yes, so I was right. Whole is a teaching hospital. Comprehensive specialist services and establish a what's that word? Quaternary hospital. Okay, I get it now. I think the teaching hospitals mostly come upstream with the medical schools. With the medical schools, yes. Then they will build a specialist and trauma hospital in the Oti region to respond to emergencies on the Eastern Corridor Road. Good one. They will establish a modern dialysis center in the Upper East region to serve the catchment area. I think that I the last time I checked, actually, I think that the upper regions, the 2 upper regions, they do not have centers for that. But I think we built the Upper East also, the Bolga Regional Hospital also. I think it was recently commissioned by President Akufo-Addo. I'll be surprised if we build a regional hospital and doesn't have this center. I'll be very surprised. So if they don't have and the one is going there, it's a good one. They said that they'll build an ultramodern hospital in Boko, Yendi, and town based on a needs assessment. But why are we not completing Agenda 111? Because when you read the NDC, I was trying to scan through to see a commitment. You see the free SHS. When it comes to the education, they did mention. I don't know if you have the education.
Improve it and make sure.
Because of time, we do the education tomorrow. But the education, I think that the free SHS, Mama has even said that they'll commit and even make it better. But for the manifesto, then there's the abridged version. They've not released the full version. I don't have it yet. But when you read the abridged version, it's not in there yet. When it comes to, so the education is here. The education one is here. So they said, I was right. So when it comes to education, for example, 0.5, they said that they improve the free SHS program by providing a dedicated and sustainable funding source. So I was looking forward to something on Agenda like 111 because you see, we cannot abandon Agenda 1, no matter the government that wins.
But then they provided that they are going to continue all government projects before they start new ones. So if
I'm saying that is vague. All government projects, I agree, but in the education, they saw the need to say that. I wanted a commitment on Agenda 111 because some of us didn't like this whole 88 thing because we knew we didn't have the money, we didn't have the financial space to do that. But if the government has already started, we need a commitment. We need a commitment to make sure that it goes through.
At this point, if they mention it, somebody else will score this political point. So.
Well, that is that. So that is what the NDC is saying when it comes to the health sector. I think that they are focusing more on infrastructure when it comes to the health sector. I think for me, when you go through the 24 points, where when you check the page 43, 44, 45, that's a lot of concentration on infrastructure. They are saying they will upgrade the Navrongo Wall Memorial Hospital to facilitate the training of doctors and nurses and all that. I also didn't get a policy on brain drain directly. They didn't speak about it, but you can glean that the mortgage policies that they are bringing
will try and
that the rural incentive of 20% for healthcare workers and all that. So if you are a nurse, if you're a doctor, this is what the NDC have for you in 2024. This is the social contract they are giving you to sign and saying that if you give them the mandate between 2025 7 January 2025 and 7 January 2029. This is what they will do. Yeah. What do you make of it?
But you remember some time ago, Mahama wanted to send nurses abroad as kind of export nurses to other countries.
This government is also doing. They are going to Barbados.
Yeah. But I didn't see them capture it in here.
I think that they didn't capture it directly, but when you look at some of their policies, you can infer that is what they want to do. So, for example, the 3 policies that jumps to me readily going through is the vehicle tax waiver, the scholarship opportunities, the salary 20% salary increment for those who are the rural areas. No, I won't say increment, incentive. The 20% incentive for them. And there's even a 4th one where we were talking about we didn't even mention the mortgage, the houses, that there will be accommodation. I want you to read that one for me again, the accommodation one. The accommodation. They said they will provide affordable accommodation within the premises of health facilities.
Yeah,
another home ownership schemes for health and other. So that makes it 4.
Yeah.
So these policies, you can infer that's basically what they want to use to retain some of our specialists here, including the specialist cardiologist. Last week, the story we shared how the wife, saved a whole region of not losing such a fine specialist. So if